The patella is a small bone that rests in a groove, or if you like, railway tracks on the end of the femur. It is seated at the end of a large muscle called the quadriceps muscle, and from the patella a tendon runs across the front of the knee, bridging the joint called the patella tendon. This tendon inserts onto a prominence of bone called the tibial tubercle. This whole mechanism is called the patella tendon mechanism, and the function is to provide anterior support to the knee but also to extend the joint. So when the muscle and the tendon contract, this provides a very powerful force on the front of the knee that extends the knee joint. Patella luxation in the dog is an extremely common orthopedic condition. We see it in all sizes of dogs, with a predominance in small breeds such as Chihuahuas, Yorkies, and miniature pinschers. This diagram depicts a fairly severe patella luxation, what we call a grade 3, which is one of the most severe ones we see. But patella luxation occurs due to a malformation of the femur. So in this case, we get extreme bowing of the end of the femur, secondary twisting of the tibia, and as a result, the patella is no longer lined up with the groove. So as a result, this kneecap is no longer sitting in position, and these guys can present with severe bowing, buckling of the legs. In milder degrees of luxation, however, such as a grade 1 or grade 2, we don't see this degree of malformation. And many of these dogs, the kneecap is actually in the groove, but it is dislocating in and out, causing intermittent lameness. So in those dogs, they may be using the leg, but intermittently hopping and skipping as the kneecap dislocates. No matter how severe the luxation is, there are several things we need to address to reposition the kneecap back in place and eliminate lameness. One of these is to actually surgically assess the groove when we have the knee open on the table, and if the groove is too shallow, we need to actually deepen this groove to provide a home for the patella to sit back in place. The second part of the procedure is to actually realign the whole patella mechanism. How we do that is to actually cut the bone where the patella tendon inserts and surgically move this bone back into a more midline position. The bone is held in place with either suture or pins, and this helps realign the patella back into the groove. The last component of the surgery is to tighten up the soft tissues around the joint, almost like tightening up a bedspread to keep the patella in place.